Protocol number 9. Now, Sam was nice enough to go and fracture this hip for us. So I wouldn't recommend it for most models, but he was, went the extra mile, fractured that hip. It was approved there. So we've had a little experience with using this laser to heal that fracture. So for fractures, we're going to come over the area. We're going to start with infrared, usually 60 seconds, and then about 240 seconds in red. Again, if you have the red, fine. If you have the infrared, not. So we're going to come in. Let me get the laser started here. Let's get it to infrared. And we're going to come over the area. So it was a nice chunk, about six inches.
Yeah.
You pop that femur. So when you look at it, you get a chance to look at some x-rays here beyond some of the other videos and that. Maybe we'll put it in the book as well. He had a big chunk just snapped. And so his foot was between two boxes of metal, turned, fell over, snapped it. Leg was going one direction, he was going the other direction, and he was in pretty good pain right away. So we're going to come to this area and we're going to work on this fracture. So we were doing it, and I think the doctor was pretty impressed when we saw the x-rays. So she's still a little bit, one of the problems, especially with treating athletes, and one of the biggest problems I have is getting the doctor to release them, because the healing times are usually 35 to 50% faster than normal. So when I was back in treating a lot of the motocross guys, one of the biggest things, they're like Humpty Dumptys. They fall all the time and they fracture bones all the time. So I was treating one of the professional guys, and what happened is that he went down hard, jammed his femur so hard it shattered his acetabulum. So we have this hip area, right? That hip bone that holds that thing in was in 4 pieces. So we started lasering. He got a laser. We let him a laser, least amount of lasering every single day here. And we were able to get him back riding in 8 weeks, right? So he was actually on a bike in 8 weeks, which is unheard of. And the hardest problem was getting the medical release from the doctor. So we finally got it going, and week 10, he was on the podium in Seattle, and it was a great story. So something that they were saying that he may not even walk on it for 6 months or be on crutches, we had him on the podium in 10 weeks. So the laser is phenomenal for doing that. We've had bowlers that fractured their pinky. They couldn't bowl, that wouldn't unite. So here we have a situation where the bones wouldn't unite or come together, and we were able to use the laser and bring that together so it healed properly. So again, reset the neurology, go to the area where the fracture is. We're going to laser over this fracture for a total of 5 minutes. And as you know, bones heal a lot slower than skin or muscle tissue of that nature. So let's say, for instance, you ever fractured your clavicle, Sam?
No, sir.
No, I haven't fractured. One of the ones you haven't fractured, so I know he's fractured a few. So we'll treat a lot of fractured clavicles, right? Number 1 bone in the body that gets broken. Normally that's about 6 weeks. I can tell you that usually we're going to have that fracture fixed in 4 weeks. So we can cut that by 2 weeks, which is pretty wonderful.
Yes.
Now you'll see a lot of athletes, like Aaron Rodgers got a couple years back, the thing that took him out was a fractured clavicle. So very common injury. So we're going to laser that. We'd be lasering, if you're an athlete, pretty much every day. If you were a regular patient coming in, probably 2 to 3 times a week, we're going to get some great results. So fractures, about 5 minutes total time. Great healing times, again, 25, 35, sometimes 50% faster than normal if you're putting all the protocols in. All right, so that's going to do it for fractures.